the detail on this one, because it will have an impact, especially on healthcare stocks.
Well, indeed, the hospital counters will be in focus after that big rate revision under the CGHS scheme that is good for the central government employees, because do remember that there were some complaints that the hospitals were actually refusing to go ahead with the cashless treatments. Yes, of course, the treatments were given, but the employees or the pensioners were actually facing some difficulties, and in order to cater to that, it's a big revision in the rates that the government has announced, wherein almost 2,000 medical procedures rates have been revised this time around, and that's indeed the biggest in almost a decade now. The new rates will be effective from October 13th, and interesting to note that this time the rates will now vary between the city category and the hospital quality as well. In terms of the tier 2 and tier 3 cities, they will be charged at a 19 to 20% lower versus the base rate. There's a bifurcation between the non-NABH hospitals and the super specialty hospitals as well, which will actually charge almost a 15% higher rates versus the other ones, and non-NABH hospitals will actually charge 15% lower rates. Now, that's the bifurcation that is given for the very first time, and that is interesting to note. But in terms of the stock reactions as well, majorly all the counters will be in focus within the hospital space, but the biggest of all could actually be Yatharth Hospitals, because that company drives almost 35% revenue from all the government schemes, because they have been on a path to reduce their contribution from the government health. It was almost 40%, but now in the latest Q1 of FY26, it's a 35% revenue contribution from the government schemes. But along with that, in some of the other bigger hospitals from the likes of Max, Narayana Healthcare, Fortis, they also drive almost 15% revenue contribution from the various government health schemes, and that will of course lead into better revenue as well as the EBITDA profile as well, because if we just take an example of almost a 10% revenue contribution coming in from government and 20% EBITDA margin, that will translate into higher EBITDA as well as revenue. So definitely a positive news flow for the hospital counters.
Okay, thank you so much, Srishti. We'll let you go on that note. Amnish Agarwal joining us at the Sawa, Head of Research, PL Capital, to talk to us about markets and more. But Amnish, let me start off with this piece with regard to healthcare stocks and what it could mean, what this development could mean for them. Any counters that you are looking at constructively, not only from this development perspective, but even generally on the healthcare side? It's been a sector in favor.
Hi.
Hi.
So the latest development actually gives more leeway to, I would say, all the hospital companies for charging more when the treatment is through the, you can say, whether the government pensions are there or various government schemes are there. Now, the margins will definitely improve. It's a big reset. It will not only benefit consumers but also the companies. Now, the extent of benefit will depend upon you can say, the companies which have got higher exposure to these schemes. They are obviously going to, you can say, get benefit. And as you rightly said, that the sector has been in the flavor. It has seen, you can say, run up. If you look at last 3 years, the EV by EBITDA multiples of, I would say, most of the, you can say, the top names, they used to be, say, 15, 18 times. Now they are trading even up to, say, 30 times plus. So there is a massive re-rating which has already happened. So beyond this, if you look at now, the sector is more like in a steady state of growth, that most of the companies can give you, say, 15%, 17% kind of a CAGR over the next 2 years. But the valuations today, they are not, I would say, as cheap as they used to be. So here on you will make only the CAGR returns incrementally going forward. So in this space, as such, there are, you can say, stocks like, say, for example, Apollo Hospitals at the current price after the recent correction, it continues to look good. One can even look at, say, Fortis, where there is likely to be open offer and, you can say, consolidation in this stake for IHH. So I think these two stocks in general, they look better in terms of the, you can say, the hospital space at this point of time.
Okay, so that's